Maybe lock the doors and turn the lights down low. Hello everybody, it's Adam from the Rural Health Workforce Transformation Hub, and in this video I'm going to tell you about how your organization can get access to the Rural Health Transformation Program's $50 billion pot of funds.
This is a bold new approach, $50 billion across all 50 states to rebuild rural healthcare from the ground up.
So here's how this is going to work. Between 2026 and 2031, CMS is going to distribute $50 billion across the 50 states. Each state will then be responsible for spending those funds on a variety of measures: maternal health, tribal health, workforce, and EMR, EHR innovation. And particularly on workforce, we're seeing that different states have applied to spend approximately 20% of their target funds. So roughly, measuring things up, we can expect to see around $10 billion going into rural health workforce transformation between 2026 and 2031. To be best prepared, I urge you to get engaged. So attend webinars that your state healthcare agency is doing on the Rural Health Transformation Program. Reach out to your state agency and ask them about a timeline, ask them how you can engage, be part of the conversation, and mix with other stakeholders that are applying for funds too. Reach out to your rural health association. It could be the Rural Health Hospital Association. I know in Oregon there's a great Office of Rural Health. Ask them what's going on. See if there's ways where you can input, you can speak to other rural health providers, and really just come together on this to understand how at this early stage can you be a part of formulating ideas, suggesting things to the state, or just connecting with other rural providers so that whenever a grant comes out, together you can talk about your applications or even partner on the grant. This is exciting, and there's going to be a lot of money spent. And you're probably wondering, well, how can we get a slice of that pie? And here's the thing, these funds are going to be spent pretty quickly. I think states want to see a big impact in 2026. We see that Oregon's going to release an RFP in February. Washington has planned in Q1 to start rolling things out. And you have to be on the ball. So my first tip is be ready, okay? Start preparing now. These funds are going to come out in 1 or 2 months. We've seen in Iowa, their best and brightest workforce recruitment and retention grant, they already announced that it's coming out. It's coming out in December. It's a few weeks away. So wherever you are, whatever state you're in, it's time to start engaging. You can look online for state name, so Alaska Rural Health Transformation Program application, and you'll probably find your state's application. We've found about 35 of them, so fingers crossed you're in one of those states. In the application, you can read what the state has planned to spend on workforce, how it's going to do it, and some of them even include a timeline. So I mentioned Oregon. It's coming out in February. They're releasing an RFP where providers can go for workforce recruitment and retention grants.
There are big buckets: workforce, people. Rural health depends on people. States can recruit and retain professionals by letting pharmacists and nurse practitioners expand their roles. And by streamlining licensing across state lines, all this becomes feasible. And without it, shortages are going to continue to choke rural health care.
So it's interesting, he's talking about practitioners going at the top of their license. So how can we get physician assistants be more productive in the absence of multiple physicians in an area? Now, the important thing to remember here is all I'm saying is high level, okay? Whenever your state's RFP comes out, if it does release an RFP, you really need to read what projects they're funding and be responsive to that. That is the clue and the trick to winning grant funding. You need to be responsive to whatever the grant awarder is asking you to submit. So it could be, for example, in Alaska. We've seen in their application, Native Alaskan communities are mentioned throughout. There's over 200 Native Alaskan tribes. Whenever the grant application comes out, say you're a rural health corporation in Bristol Bay, you're going to need to say how you're going to help Native Alaskan communities, how your response is programmed to what they're requesting. Whenever it comes to winning grant funds, always remember that. So look out for your RFP, read through it, and really understand what is the intention of this RFP. What are they trying to achieve with the funds? And then go out and come up with a program that does that. Now I'm going to break down Oregon's application for you so you can really visualize what I'm talking about. You see here that they say a strong workforce is the backbone to sustainable, high quality, healthy America. And if we scroll down a bit, they say to strengthen recruitment, this initiative will invest in strategies that attract providers to rural areas. So they have that relocation component, which I talked about. Financial support will be offered to students and recent graduates pursuing health careers in exchange for 5 years of service in rural communities. If we go further down, you can see more use of funds. invest in development of track residencies, expand workforce training, expand investment in telemonitoring, and establish new or expand provider-to-provider consultation lines. If you look at any state applications, they're going to have something different. So for that reason, it's really important to go through this. I think what's interesting is on that recruitment or retention component, the most impactful thing will be bringing people from urban areas. You can see the expected 5-year service commitment is tied into that. I'm a little bit skeptical of how that's going to go. So it's hard enough to get people to stay, for a few years. If you're going to get them to stay for 5 years and get them to sign on the red line for that, it's a big commitment. It kind of makes the relocation harder through this program than just doing it yourself, where you don't need to have that commitment. But we'll see how it comes out. I think these funds are better spent whenever you make the application and saying, here's our holistic, sustainable response, rather than throwing all the money into sign-on bonuses, all the money into relocation. That's great, but if you have a pot of, say, 20,000 per provider, perhaps 5,000 to get them a free moving setup, and perhaps 2,000 in rental support, a few thousand in a sign-on bonus, and the rest, it's a good idea to pull that into an initiative that's not one-to-one, but one-to-many. So something that will benefit everyone that relocates to your area. And here you could collaborate with other facilities. So how can you make a fund with the local long-term care facility, the local home care provider, critical access hospital, rural clinics, coming together to say, together we're pulling an application for 500,000, for example, and we're going to invest that in housing units, rental support. We're going to have a dedicated coordinator that brings people in, helps them visit, introduces them to people, pays for those lunches, and really make a program which is kind of the welcome guide, the intro guide, and the visitation guide. Something that kind of provides, tangible, but at the same time, emotional benefits that are beyond just money. Because if a provider's earning 300 grand a year in the city, and we know that rural providers don't have that money, you're offering them 25 grand a year less. Over 5 years, that's 125,000. You're not going to give them 125,000 sign-on bonus. So at the end of the day, they're still going to earn more in the city. You need to play up the area, and you need to play up how you're going to integrate people, help them improve their lifestyle, help them integrate into a new community, and experience what rural really has to offer. So I hope you found this video useful. It's early days. We've only really seen Iowa release their notice of intent to release a grant. But as things come out, I'll be keeping on top of it, and you can watch more videos on rural health workforce transformation. Click down below or just explore our page. And if you're interested in help, if this is all a little bit overwhelming, you want help, our Rural Health Workforce Transformation Hub is here for you. So we're going to provide technical assistance, free grant writing support, and program design ideation to rural health providers to help you really understand, here's a perfect proposal, how to win these funds. And if you want, we can help you implement it too. So reach out to me, and hope to see you in the next video.